A caregiver is a person who is responsible for the physical and emotional support for those people who can take care of themselves.
Hi, I'm Monneth Lobo, student trainee of ncma Malaysia, Batch 8 Extension. Today, I'm going to discuss to you the 10 qualities of a good caregiver. Number 1, patience. Patience is having the ability to keep doing something without being annoyed. It's not easy to take care of adults. Older people may take a long time to perform their daily tasks, depending on their cognitive diagnosis. It may require the different level and type of communication. Number 2, cheery demeanor. Cheery demeanor is a cheerful behavior towards others. A cheerful attitude makes whatever you are going through is easy to bear. Some patients are angry, depressed, or frustrated every day. But seeing you in the positive attitude can brighten their situation and help them feel good. Number 3, multitasking. Multitasking is the act or skill of managing more than one task at once. It applies by helping with activities of daily living such as grocery shopping, preparing meals, cleaning, bathing, and managing medical care of the patients. Number 4, being able to think quickly. Inclined to make sensible decisions very quickly, and especially in a dangerous or difficult situation. As a caregiver, staying calm will ensure that your patient also remains calm. Instead of reacting to the change in plans with panic, a great caregiver will quickly and effectively create a new idea and carry it on seamlessly. Number 5, punctuality. Punctuality is a characteristic of being able to complete a required task at designated time. As a caregiver, when you are late for your shift with other caregivers, patients, or patients' family who value their time, you will have wasted their most valuable asset. Valuing others' time is earning their respect, an important part of your individual reputation. Number 6, willingness to learn. Willingness to learn is desire to acquire a new knowledge. Situation will arise to the patient that you may never encounter, and it presents the opportunity to approach care in a new way. It's best to have an enthusiastic attitude towards a new experience. Number 7, being a good listener. Being a good listener is paying attention to the speaker and acknowledge the message. Active listening, responding appropriately to patients' needs, and number 8, kindness and empathy. Kindness and empathy is the ability to understand and share someone else's feelings to the extent of imagining the other person is thinking and feeling and respond it with care. Expressing kindness and empathy to the patients help build their trust and improve health outcomes. Number 9, willingness to go extra miles. Willingness to go extra miles is not only the willingness to make the special effort to do, but also you are willing to assign in far places but not to the extent that you are not happy or comfortable. Number 10, being able to take responsibility. Being able to take responsibility not only for yourself, for your family, but most especially taking the responsibility to your patients. On behalf of ncma Malaysia, I would like to welcome you today. I'm Monneth Lobo, one of the student trainee of Batch 8 Extension. Before I start, I'd like to share some information about NGT. NGT or nasogastric tube is also known as NG tube. It is a plastic or rubber tube that was inserted to the nose, down to the back of the throat, and to reach the stomach. The video that you will see is about enteral feeding via nasogastric tube. It is a process of giving liquid nutrients or medication through a tube when the oral intake is inadequate or impossible. But before we proceed to the patient, we will do the proper hand washing. Hi, Mom. I'm Monneth Lobo, your nurse assistant for today. What is your name?
Maria.
How about your age?
34.
Please allow me to close the curtain for your privacy. Today, I'm going to feed you using the nasogastric tube. Kindly let me know if you feel discomfort or any pain during the process. These are the equipments I will going to use.
Before applying the procedure, do the hand hygiene again, then wear your gloves. Elevate the bed or position the patient sitting upright. Put the towel over the patient's chest. Check the placement of the nasogastric tube to ensure that the tube is secure and it will not be out of place. Attach syringe in the nasogastric tube. Check or aspirate for any stomach content to test the pH level. And then put the gastric content on the specimen cup. After that, put the gastric content on the pH strip and check the pH level of the patient. After you confirm that the tube is in the stomach, check the feeding schedule of your patient. Then prepare the correct amount of oral food supplement as prescribed. Hold the syringe 18 inches above from the patient's stomach. Pour feeding formula with 30 to 60 ml at that time. There are the two types of formula, in powder form or liquid form. Please ensure the syringe is not empty. Always remember to stop feeding if the patient feels difficulty in breathing, coughing, choking, vomiting, nausea, and diarrhea. After you feed the patient, you will flush the nasogastric tube with a 30 ml of water as per prescribed. Check the patient's response after feeding. Clear all the things has been used for feeding. Remove the towel from the patient. Discard all the used equipment and put on prescribed trash can. Remove your gloves and discard it. And then properly sanitize your hands again. And then lastly, clean your workplace area and don't forget to record all the finding or all the procedures that you have done.
Good day everyone, I'm from NCMA Malaysia, Batch 8 Extension. I'm Monneth Lobo. This video will show you the procedure on how to perform a transferring of the patient from bed to wheelchair and wheelchair to bed. Transfer is an act of moving a patient from one flat surface to another. Patients who require this kind of transfer are generally immobile or acute ill. Before we start the procedure, we do the proper hand washing. Before I proceed to my patient, please make sure the privacy by closing the curtain. This is the equipment that I'm going to use. The improvised wheelchair and the improvised gait belt. Hi, Mom! I'm Monneth Lobo, your caregiver for today. What is your name? How are you today? Today, I'm going to transfer you from bed to wheelchair. Fold the blanket. Check the vital signs. Can I check your vital signs? Everything is normal. Bend the one knee. Hold your one hand with the knee of the patient and one hand on the shoulder. Turn on the side position, facing towards you. Put both legs down on the bed. Hold your one hand on the hips for the support and one hand on the shoulder blade. Slowly lift up your patient from the sitting position. You feel dizzy? Just make sure that the both legs are in the floor. Put your wheelchair close to the bed. Put the gait belt over the waist. Flex your hips and your knee outside the both legs of the patient. Instruct your patient to put her both hands on your shoulder. Mom, please put your both hands on my shoulder. On the count of 3, I will transfer you from bed to wheelchair. 1, 2, 3. Remove the gait belt. That is how I transfer my patient from bed to wheelchair. Now, I'm going to transfer my patient from wheelchair to bed. Put the gait belt over the waist. Flex your hips and your knee outside of the both legs of the patient. Instruct your patient to put her both hands on your shoulder. Mom, please put your both hands on my shoulder. On the count of 3, I will lift you going back to the bed. 1, 2, 3. Remove the wheelchair. Remove the belt. Hold your one hand to the shoulder blade of the patient. Hold your one hand to the hips of the patient for the support. Lay down your patient slowly. Put the both legs back to the bed. Turn your patient to the comfortable position. Then, put the blanket on. And that is how I transfer my patient from wheelchair to bed. I'm Ms Lobo from NCMA Malaysia, Batch 8 Extension, at your service. Hi everyone, it's my pleasure to introduce myself. I'm Ms Lobo, a student trainee of NCMA Malaysia, Batch 8 Extension. I'll demonstrate you today on how to bathe a baby. Hygiene is an important aspect of baby care, and a daily bath is essential to keep the baby clean and fresh. Bathing a baby easily and safely can accomplish by keeping in mind a few tips and keeping an eye out of any precautions you might take. The most important criteria in choosing where to bathe a baby is safety. The best place is in the kitchen near to the sink. Remember to clean and wash first before putting the things needed. You can bathe the baby anytime, but the best time is 6 a.m. to 10 a.m. for about 10 to 15 minutes only. Is it advisable to do so before a feed? Bathing a baby too soon after a feed can cause the baby to be uncomfortable and spit up milk. Before we proceed on bathing, we need to get the consent of the parents and explain the procedure that we are going to do. After getting the approval of the parents, we can now check the baby's temperature. The normal temperature of the baby is 36.5 to 37.5 degrees Celsius. If the baby's temperature is 39 to 39.5, it means the baby have fever. You can still bathe a baby even have fever? Yes, you can. But you need to do a quick bathing with cold water. After we check the temperature, we will collect the equipments. Make sure you have everything you need before bathing the baby. This will ensure you don't have to risk making the baby feel cold by bringing them to get something.
We need the following: 2 basins, 1 for soaping, 1 for rinsing, alcohol, baby lotion, baby powder, cotton balls, cotton buds, baby liquid soap, thermometer, diaper, rectangular mitten, 2 towels, 1 for bathing, 1 for drying, baby clothes, warm water, and dustbin.
After we prepare all the equipments, we will proceed to proper hand washing and ensure all the necessary items are within your reach. Remember, never leave the baby unattended during bath time. After washing, provide the baby's privacy. Preparing the baby's bath. Fill the basin with warm water and 3 drops of soap. This basin is for soaping. Fill the other one with warm water. This basin is for rinsing. Check the water temperature using your elbow or top of your wrist. Make sure it's comfortably warm and not too hot. Get the baby from the crib.
Place the baby onto the bath towel and gently undress. Cleaning the baby's eyes. Dip the cotton ball into the warm water and squeeze out the excess water. Clean the baby's eye by starting in the inner canthus towards the outer canthus. Use a new piece of cotton ball for the other eye and do the same stroke. Do not reuse the same piece to clean back and forth. Observe for any sticky or yellowish discharge on the baby's eyes and bring the baby to the doctor if discharge persists. Pat dry using a clean towel. Cleaning the baby's face. Wash the baby's face using the warm water. You can either use a face cloth or cotton balls dipped in the water. Clean the baby's face using any of the facial stroke: S-stroke, Z-stroke, or 3-stroke. Clean the baby's mouth by using your pinky finger with a clean cloth. Gently clean the baby's otic using a cotton buds. Pat dry using a clean towel. Cleaning the baby's neck. Using a cotton ball dipped in warm water, tilt the baby's head in the sideways. Wipe the neck from medial towards to lateral. Using the new cotton ball, do the same procedure on the other side. Pat dry using a clean towel. Lift the baby and carry using the football hold, with the palm supporting the head and neck and tucking between your arm at the side of your body. Tilt the head slightly backwards over the bath basin. This position is called Trendelenburg. Washing the baby's hair. Gently wash the baby's hair starting on the frontal, in the parietal, occipital, and lastly, in the temporal. Be cautious when washing the fontanelle of the baby. Rinse and pat dry. Place the baby back on the table. Using the rectangular mitten dipped in warm water, Gently clean the upper extremities of the baby. Start from the neck, axillary, skin folds, interdigits of the hands, and body. Turn the baby on the side position, clean the back of the baby, then clean the buttocks area with cotton balls in W motion. Turn back the baby in supine position. The front genital area of the baby by using the cotton balls dipped in warm water. Get a cotton ball, start to wipe from mons pubis down to inguinal area. Use another cotton for mons pubis to labia majora. Another one for mons pubis to labia minora. Repeat it in other side. Then lastly, from mons pubis down to clitoris, to urethral orifice, to vaginal opening, down to anus, and throw the cotton balls. You are now ready to place the baby into the basin. Washing the baby's body. Position your right hand under the baby's shoulder to support it and hook your fingers under the baby's armpit to have a good grasp. Slide your left hand under the buttocks and grip the baby's thigh and lift the baby into the basin. Allow the baby to sit in the tub with your right hand still supporting the baby's shoulder while keeping the baby's head above the water level. Release your left hand grip and bathe the baby's body. Wash the upper and lower extremities, including the skin folds and interdigits of the hands and feet. Once done, use your left hand to take over the grip under the baby's axilla and allow the baby to lean forward over your right arm while you rinse the back with your left hand. When you are done, lift the baby out of the water. Put back the baby on the table with a clean towel and pat dry. Pay attention to the skin folds and be sure to dry behind the otic, interdigits of the hand and feet, axilla, and genital areas. Dressing the baby. Do not overdress the baby. Wear clothes that are comfortable for the environment. You may apply the baby powder and baby lotion with the consent of the parents before dressing up. Put the new diaper and clothes. Now that the baby feels fresh, clean, and comfortable, it's time for a good feed. put the baby back into the crib. It's time for your milk, baby. Oh, she don't want milk. We try the pacifier. She don't want the pacifier also. Maybe she wants to sleep cause she had a good bath. Clean the place and throw the used things slowly. Shh, the baby is sleeping. Wash or sanitize your hands again. Write down all the procedure you've done.
And that is how to perform the infant bathing. Once again, I'm Monneth Lobo, thanking all of you. Till next time. Bye-bye!